There are two types of radiation: ionizing radiation and non-ionizing radiation. Ionizing radiation includes X-rays, alpha, beta, and gamma radiations. Occupational exposure to ionizing radiation occurs in workplaces where ionizing radiation is used, as in medical radiodiagnosis and radiotherapy, sterilization of plastic or rubber instruments such as intravenous cannula, detection of defects of manufacture such as cracks in gas cylinders or iron bars, searching for undersea or underground petrol layers, disinfecting seeds and killing germs before storing, and finally, research in atomic reactors and science institutes. Ionizing radiation induces free radicals, which attacks the cell constituents. This induces lipid peroxidation of the unsaturated fatty acids of the endoplasmic reticulum and destruction of the DNA of the nucleus. Acute health effects, which is called acute radiation syndrome, occur on sudden exposure to high doses of ionizing radiation, as in atomic explosions, or on accidental exposure to radioactive bodies, as happened in Meet Halfa. Acute radiation syndrome may include destruction of the mucous membranes leading to severe watery diarrhea with mucus sheds, destruction of the bone marrow leading to severe anemia, leukemia, and thrombocytopenia, cataract, and abortion. Death may also occur due to superimposed infection and reduced immunity. Delayed effects may occur long time after acute exposure or after prolonged low-dose exposure. They include radiodermatitis, cancer, as cancer of the skin and leukemia, varying degrees of anemia, cataract, congenital anomalies, increased rate of abortion, sterility, shortening of the lifespan, and early senility. For prevention of ionizing radiation hazard, first, environmental measures should be applied. Whenever possible, substitution of radioactive materials or operations exposing workers to radiation should be done. If not, segregation of the radioactive sources in remote areas of the workplace or of the town should be done. If this solution is still not applicable, isolation of sources of radiation by leaded materials in the same workplace is an alternative. In addition, strict regulation of usage and limiting exposure to certain trained personnel is very important. And finally, frequent monitoring of environmental exposure at the workplace is mandatory to check your environmental preventive measures and to take corrective actions whenever needed. In addition to the mentioned environmental measures, medical measures should also be performed. First of all, pre-employment examination, including complete blood picture, then periodic medical examination, also including complete blood picture every 6 months, and early detection of skin or other system affection should be performed. Using personal protective devices as leaded aprons is mandatory. Periodic monitoring of personal exposure to ionizing radiation through personal dosimeters as badge film. Occupational exposure to radiation should not exceed 5 rem, which is the Roentgen equivalent man, or 50 millisievert per year. However, workers should not exceed half this amount, which is 2.5 rem, in a 3-month period, or for the whole period of pregnancy in case of females. For general population, exposure should not exceed 2.5 rem per year. Regarding non-ionizing radiation, it includes infrared radiation, ultraviolet radiation, and microwave radiation. The skin and eyes absorb infrared radiation as heat. It is emitted from hot objects, thus workers normally notice excessive exposure through heat sensation and pain. Sources of infrared radiation include furnaces, heat lamps, and infrared lasers. Occupational exposure occurs on exposure to extremely hot red objects, as in iron and steel industry, ovens, melted metals, Glass industry. Infrared radiation mainly affects the eye lens, leading to posterior polar cataract. The accompanied heat can induce heat disorders. Regarding ultraviolet radiation, it is particularly hazardous because there are usually no immediate symptoms of excessive exposure. Sources of ultraviolet radiation include the sun, black lights, welding arcs, and ultraviolet lasers. Occupational exposure to ultraviolet radiation occurs during electric welding of metals, using photocopy machines, phototherapy of skin disorders, and sterilization and disinfection in surgical wards. Ultraviolet radiation affects the eye and skin, causing conjunctivitis and corneal ulcers. Skin is also affected, causing skin erythema, burns, and even skin cancer after prolonged exposure. Microwave radiation is another type of non-ionizing radiation. It occurs mainly in the kitchens of hospitals and hotels and in some homes. The risk of exposure increases in the presence of unsafe utilization, as usage of metal or reflecting materials, and in case of bad maintenance, as ill-fitting doors. This causes leakage or reflection of the microwave to the surrounding. Microwaves induce heating in the deep tissue. The damage can occur without being noticed because the superficial tissue or skin escapes the heating effect. For preventing non-ionizing radiation hazard, follow the general rules of prevention of occupational diseases, the most important of which is the use of protective goggles, which are special eyeglasses, and protective aprons if needed.